What's going on, my Support Fibromyalgia friends? How are you doing? It is a gloomy, gloomy day over here in Southern California. I was hoping for a little bit more sun, but I wanted to check in with you. It's been a little bit of time since I've done a live, so I thought I would jump on here impromptu again and do another live session with all of my Support Fibromyalgia friends. I am Melissa Tolwar. I am the executive director of the Support Fibromyalgia Network, and I'm also a board certified functional medicine health coach. This is going to be an organizational update more than anything else. So I just wanted to give updates on news. Stay tuned for some reels that are going to rally support around these news items. But I wanted to make sure that you were seeing the posts and getting the information that you needed because we have some really important things happening and we need to hear from you. So I'm just going to kick it off with some news updates, and I might do some ramblings as we go on. From here, if you are out there, please chime in, say hello, let us know where you're tuning in from, or just post an emoji of how you are doing, and then like and share with all of your friends. So we definitely need the rally support. So if you can share with other fibromyalgia warriors out there. We really appreciate it. So any of this content resonates with you, we'd definitely love that. So give us a shout out. Let us know you're tuning in, and we will highlight you as we go through. Okay, so first up, it's April. Welcome to April. So April means we are ramping up for Fibromyalgia Awareness Month. Yes, month. We are sticking to that. We are going to take the month of May along with it. So not just the only day. So May 12th is Awareness Day or World Fibromyalgia Awareness Day, but it's all about May and ramping up. There's going to be a lot of things. And I know it's difficult when we call about awareness because it starts to become more of a celebration. And I know all of us deal with fibromyalgia the whole year round. So, I mean, that's why here at Support Fibro, we make sure that we do awareness and advocacy all year round, but it does ramp up in May to coordinate with other things and other things that are happening and events and awareness. And when we talk about awareness, we really want to raise awareness for fibromyalgia as far as education goes, letting people know where we're at, what we need. So this is going to be the theme for this year. We got to ask for what we need, right? We got to raise our voices and let people know what we need because we need a lot, right? There's a lot of strife and I hear it and there's a lot of struggle. So we got to be ready and willing to raise our voice, either social media or with congressional meetings as well, and ask at different levels. Like if we don't ask, right, we'll never get it done. So this is going to be the big moments where we got to rally for our support. And I know it's difficult. I know a lot of us are tired of fighting. We feel like we wake up. I know I personally do wake up and we have to go to fight again. Not only like advocating for ourselves in our healthcare system, but advocating for everything we need, maybe in our family, with our friends. How do we share? So this is all where we come together too as a community and we provide a community of support. So Fibromyalgia Awareness Month is in May. Let everybody know and join us on these channels as we are going to do a lot more education. We're going to bring back some interviews, patient education, and other activities. And we're going to support other organizations and other advocates as they rally as well, and come together. And hopefully we'll do international stuff this year too, even more so. We have a lot of amazing international advocates out there that we want to continue to support. They do such amazing work. And I think if we can bring the community together, community united together, and there's amazing people, so much heart, that we can do great things and changes here because growth is happening and we can only get there if we create these changes, and we're going to have to do it together. It's not going to be one person or one organization that can do it all. We have to come together and unite and build those changes. So getting into the news updates, please fill out. We have a survey that we joined forces together with the Veteran Voices for Fibromyalgia and the Fibromyalgia Pain Chronicles. So it's a family survey for just kicking off the process. It's patient driven. So it's organized by patients and put together for patients. And you can be anywhere in the world and fill it out as we try to ignite more research in areas that we need. And it is the start to something great and the start to something new with pushing, again, continuous patient-driven research and stuff that we need to get done. So look for that. I'm going to add the links into the comment sections. It's a quick Survey Monkey survey that you can find it too on the Fibromyalgia Pain Chronicles. I know she posted it, Crystal did. And then the Veteran Voices for Fibromyalgia will be sharing it again as well. So please help us out by filling out that survey. I know we'd like to get a whole bunch of people. We are under 1,000. We like to continue. So we have millions of us out there. Please share the survey. You don't even have to include your name. This is about figuring out whether there's family members and relationships with family and fibromyalgia. We know that there's some sort of genetic component, but we'd like to get some data on this with the survey system and then also be able to have this information for our congressional meetings, which I will talk about. So on May 11th, we are headed virtually to Capitol Hill to host meetings with Congress. And we definitely need some more fibromyalgia advocates, fibromyalgia warriors to join us on May 11th. It is a day of virtual meetings. You get to meet with your congressional leaders, and a lot of people have found it very empowering. You don't need to have experience. So if you're new and you want to raise your voice and you feel like you want to do it, but maybe you're unsure, reach out to me. It happens all the time, and we will provide you training and the support you need. You will be matched up with a fibromyalgia team leader that has done it before. And we will join you in these meetings, so you won't have to do them on your own. You won't have to learn the process on your own like many of us had to do in 2019. But we need you. We need these voices. And I'm just going to tell you out there, it's working. So the strange thing about what happened when we went in 2019 is we saw the budgets were super low for the investment in fibromyalgia. Now, when you go to the NIH research disease budget breakdown, if you just search for fibromyalgia, there's a strange uptick after 2019, which is super cool. So either they totally forgot about us and had to update their database because it was incorrect, or they decided to do some more investment into fibromyalgia. I would love to get the answers for that, but it is kind of cool to see the increase and the estimated budget increase in fibromyalgia. But our work is yet to be done because we have to rally our congressional leaders. We are looking for some champions, because if we make some more moves for legislative change or want to increase budgets, we're going to need some people that are going to champion for fibromyalgia to build off of additional things that we might need. We're looking to potentially join some more caucus type stuff. So we'll have some more information about that. And then we're also looking for more reclassification of fibromyalgia with the budget. So looking to move fibromyalgia into a new NIH type of house so we can get more information. So there's a few asks, and we'll go through all of that with you. And then not only that, so if you decide that maybe virtually cannot go because you have to work, or it just is not necessarily, if our international friends want to do this, we want to have a social media blitz campaign. So on May 11th, advocacy will start at the beginning of the week. You can start and just tag your congressional leaders on social media. Let them know we will do a virtual Hill Day. Let them know we're rallying all our voices together. So there's so many ways you can participate in advocacy, and that's the movement forward, right? We've had awareness for many years. We've done the awareness thing, public health awareness on fibromyalgia. Now we're taking it to a whole new level and adding advocacy. So raise your voices in May for fibromyalgia advocacy as well. Don't forget, and there's different ways to join us. If you know that you cannot make it May 11th, but still would like to participate in virtual meetings, we always get meetings kind of rescheduled or have backup days. So maybe you'd be able to attend those backup days, because we really want want to include new people in this, even if you can take one meeting just to get the experience and experience what it's like, I highly encourage it. This is a great opportunity to work with people that will mentor and walk you through the process, because I know sometimes on virtual you might just be thrown into it, and it can feel like that with Fibromyalgia Advocacy Day, but we really do our best to just be there, right there with you, and empower you and let you know why we're doing what we're doing and give you updates on some of the exciting aspects. We've had really good experiences going to Hill Day. Last year was all virtual and it was a great experience too. We eventually, I think we'll go, oh, not I think, we eventually will go back to Capitol Hill in person and try to include a hybrid event. I love being virtual, so I gotta mention that we want to do it hybrid so that we can expand and include. And my goal eventually is to see an advocate in every single state. I would love to get to the point where we have fibromyalgia advocacy going on in May in every single state. And we're going to have to do this multiple times again. We need our champions so that way we can continue to make legislative change. We need an increase in budget so we can get fibromyalgia classified correctly into the right place. And that's where we need the budget breakdown. We need an increase starting to move up in estimated budgets, but we really need a concentrated focus on fibromyalgia specific research. So this is where it's interesting to see the parallels with our wonderful cousins MECFS and the work that they've done. It's been invaluable for them to do their advocacy and watch it happen. And I know that they're working on increased investment for MECFS, but one thing that they have accomplished, and maybe the budgets are not as high, but when I look at the research that's getting funded, it's very specific to what they need. And they've organized systems in the research sector where they can apply and get some of that money directly. So this is the same thing that needs to happen with fibromyalgia. So yes, there's been some increase in funding for fibromyalgia research, but now we need to instill that it's going to what we need for fibromyalgia specific information and to look at some of this classification so that we get the right classification. We can open it up for other treatments and figure that out. So it's like a whole other step for this. So we've got some attention. We've been to the cap, then everybody agrees in Congress, like we definitely need an investment based on the number of people who are diagnosed with fibromyalgia. So there's a lot of strategy that we're following through. And this is definitely the marathon. We have to go at it slowly, but we're definitely passionate about it. And we started something in 2009. So we're going to continue to push and we need you. So please help us by raising your voices this year for Advocacy Day. And again, reach out if you have any questions. I'd be happy to answer them. Then Awareness Day is on May 12th. So there'll be a lot of festivities, a lot of people to support, amazing things going on. We also have Project Echo for medical education, something that has been a passion of mine since this organization began, hurdle after hurdle, getting the attention of medical providers out there. So we've had some medical providers sign up. We were reaching out and scheduling meetings, but we need more. We need our experts to teach. People willing to teach other providers, specific also like primary care providers all around the country and all around the world. It is international, so we can have a couple of echoes running simultaneously in the United States and somewhere else with time zone based things if there are providers interested. So if you have a medical provider that is interested in either teaching or learning more about fibromyalgia for continuing medical education credits that are free, they don't have to pay for it. So it's just a sacrifice in their time of learning. That is Project Echo, because it's all about democratizing fibromyalgia education so the medical providers can get updated fibromyalgia education and they can transfer this to all of you, the patient community, and be able to understand what treatments are out there that are updated. Learn from other providers, no matter where you're at, because we want to try to slow down this whole I have to travel to a different state to see a specialist, fibromyalgia specialist, which are far and few. And then you're traveling maybe 4 hours. So we're really trying to get it at home within you and build that community of support. So Project Echo is huge. We do have forms for all of these things. So if you have a provider interested, and we're going to improve having more documentation that you can take to your medical provider if they're interested, we would love to have more providers get involved. It's a huge, huge task that I really want to see come true. It's one of those dreams and passions that I really want to have get it done so that our medical providers can learn fibromyalgia education. They can get updated on the latest research, make sure you're getting diagnosed correctly, ruling out other conditions. So we want other experts too in other fields like Lyme and EDS to also give lectures on differentiation, and even in the rheumatology sector of autoimmune versus like early stage autoimmune. So education is the key for our medical providers, and we want to cut down the barriers so that we can democratize the knowledge. Also coming up, again, shout out for that gaming dad. I want to do a giveaway coming up shortly for a cool package for that gaming dad. We are racing for research. He's over there on Twitch. Please go give him a follow. And shout out to him for all the great effort that he's been putting in. We got a race for research. So we got a fundraise for research. Things we're doing, patient-driven research for fibromyalgia is super important. We need to say what we need because we need a lot more research being done in other areas so we can get the treatments and the answers that we need. So that's a big deal with Race for Research. Also, if you haven't yet seen some of our videos and our video interview with Latoya from Butterfly Chats, she is doing amazing work over there at butterflychats.com with her podcast, her mindfulness journal. I know we gave her a shout out. We're going to give her another shout out. Woo, I got it stuck. So here's the mindfulness butterfly journal, and you can fill it out, purchase it. We love supporting our advocates. So if you have other projects that you're working on, please let us know. But with mindfulness, it's something that I'm exploring more personally. If you're struggling with that, please definitely reach out to Latoya and chat. I know I'm going to reveal that struggling with the gratefulness, like the idea, and people like wake up and have gratitude or write down things that you're grateful for. I struggled a lot with that, and I still do because everything felt repetitive. Like I was only grateful for the few things that came to my mind. So one thing that helped me a little bit was changing the words and just finding things that brought me joy. So I would focus on things that brought me joy, and it was easier for me to troubleshoot and come through. For some reason, it made a lot more sense to me. So if gratitude doesn't necessarily work for you, there's other changes, and this is where mindfulness is all about, and being in the present moment. Because I know it's difficult, and something that I'm getting more training in. There's mindful.org where you can learn more. I'm currently doing some more mindful eating, taking a pause. So I'm not just gulping down my food and thinking about all these other things while I'm eating. So I'm focusing on that. But it's difficult. It's a difficult process, and especially when you're finding joy. So I had to do that, and just little things that I could find joy in. Like I love my dog Toby. He brings me so much joy. Or the smell of coffee in the morning, or, my first sip of coffee brings me so much joy. Watching my favorite TV show, or I love superheroes. So watching my favorite superhero TV show brings me joy. And then finding changes that you can do. So I'm a big punk rock girl. I was always at the concerts in the mosh pit. But physically, that isn't where I can be at this point. And then obviously with the pandemic, things changed. But I can still find joy in music. And I can remember that too. So if I'm doing maybe a chore I don't necessarily like, I can always throw on my music and bring in some aspects of joy. So if I have to fold clothes, which many of you know, I struggle with my laundry and putting away my clothes, but I found that throwing on music in the background really helps. Or sometimes I'll just like watch live videos from the bands that I love and sort of imagine myself being there and jamming along. And then that brings a little bit of that joy out. So I don't miss necessarily being at a live show. I'm like, okay, this works. I did love things switching to virtual because some of the artists would perform on social media doing live shows. And that has been really fun for me. It's a whole new aspect. And so just see if you can find little things that bring joy in your life. And it does add something more. Okay, so that's part of it. And again, this is just a news update and random rambling. So just checking in because it's been a while since we've done some videos. We're going to be doing some more recorded interviews with other advocates and researchers coming up. I'm probably going to be doing some nutrition videos. I'm not clear if I'll be uploading them or doing some live videos. I'll try to do some more live videos. I'm honestly going through a few health challenges that are new. So there's some unpredictability there, but we're definitely going to do what we can. Fundraising. So if anyone out there wants to do fundraisers, please reach out. We appreciate it all the time. We have ways that you can fundraise. If you are shopping through Amazon Smile, we are a registered nonprofit through Amazon Smile. eBay, if you do sell through eBay, you can donate portions of the proceeds to our nonprofit organization. We have PayPal links. We have other ways. I don't know if we wrapped up our Seas Candy sales. So thank you to everyone that did that. We are looking for other ways to fundraise as well. If you are on Facebook, you can do a birthday fundraiser or just host another fundraiser. We appreciate all our Facebook funding that we can. So there's different, and we need ideas. If you have ideas out there, we will more than happy to. I think as people start going back into restaurants, maybe that's something that we can try again. If anyone's interested in doing those in your state, please let us know, especially coming up for May, because we need to fund those programs, right? More advocacy training, more patient education. Project Echo, need to get the medical professionals funded. We are looking at other larger virtual scale events coming up in the fall. So a lot of stuff for the fall on patient education and getting you updated resources that we need. So definitely help us fundraise. We are nonprofit registered organization. We are headquartered in California, but we have advocates all around the country, and we do support other people and advocates internationally too, and we support groups. I know a lot of people ask us if we have support groups. We need to put a better list on our website, and I need to update that list. What we decided to do early on was, because there are support groups existing and amazing people running them, we didn't want to white label our own, which is weird. And we wanted to interact with existing support group leaders and organizations with support groups that are already operational and help them with any fibromyalgia related information. If they needed updated resources, if they needed speakers, anything like that, or how we can support them if their group needed resources. I know when the pandemic started in 2020, we were sending out supplies to them. So big, huge packs of toilet paper, wipes, disinfecting wipes, detergents, shampoos. So the support groups actually became a resource for us to deliver goods to other people. So we always want to make sure before we create our own support groups that we already support existing ones. And there's an amazing group of people. If you are interested in starting your own support group, though, we would be happy to connect you to people that already have those groups for training and mentorship, which is something we believe in completely, is this mentorship. We don't want you to have to like reinvent the wheel. We want to create this sustainable community of support where you feel like you can reach out to other people and they will help you with no strings attached, and they will guide you and give you the support that you need with mentorship and encouragement and empowerment. So that's been huge for our organization. So if that is something you're interested in starting in the new year, and I know as we go back to these hybrid events, some of the support groups have stayed completely virtual. Some will go back and meeting in person, or try both. And I know there's a bunch of you out there that we still need to connect with. So if you do have a support group, whether it's for fibromyalgia, chronic pain, lupus, but lupus, if you're open to adding fibromyalgia patients, please let us know, because we can refer. We get a lot of people asking us for support groups, so we're happy to refer. And even in other countries, if you're hosting a support group, I see in other countries they meet up. So let us know. We can add you to our website so that way people can find you. We can do an interview with you. We love to share what other people are doing around the world. So please, please do reach out. Stay tuned for so much more. When it comes to all the things that we're working on, it's a lot. So we'll do our best to keep you updated. I appreciate your time out there. More stuff coming down the pipeline when it comes to nutrition, health coaching. We are going to launch a health coaching group. I also want to launch a Walls Protocol healthy coaching group. If you are familiar with the Walls Protocol or want to get to know more of the Walls Protocol, I'm going to be setting up a live webinar where we can interact with each other and you can learn what the heck the Walls Protocol is all about and learn more. And she has this special portal which we want to offer too. And as a health coach that's trained and certified in the Walls Protocol, I have access to special material. So I want to bring that to the fibromyalgia community. Dr. Terry Walls really inspired me to take a lifestyle into my own hands and advocate for myself in a whole new way when it came to functional medicine. So I definitely want to bring that empowerment, that resilience to the fibromyalgia community. So let's get it done. And definitely, please, please join us with Fibromyalgia Advocacy Day, whether it's on social media or I'd love for you to join the congressional meetings. I want to see it in all 50 states. So anyone out there who may be a little bit shy, unsure, I encourage you to reach out. Let's just talk about it. And even if you could just watch too for some of the meetings, if you just want to sit there or maybe just wave and say hello, I'll say that you're joining us, but you want to observe, I'd be happy to let you do that too. It's all about learning and training and sharing an experience together. Okay. So reach out for Advocacy Day, share on social media. It's coming up. We need our congressional leaders to know that fibromyalgia is not going to be forgotten. We are not going to let it go. We are going to continue to fight for the things that we need. We're going to continue to ask for the things that we need, right? Communication, asking for what we need and raising our voices for what we need. So thank you so much to all my Support Fibromyalgia friends. Okay, so hello to friend. Thank you so much. Appreciate it. Yes. Oh, you are in the long journey. What do we call? We need to come up with a name for I guess it's not veteran of fibromyalgia because it just threw me off because we work with the veterans for fibromyalgia. But it's just when you've been dealing with managing with fibromyalgia for a long time, like I have, it's just when you're what is that? What do you get for that? Like a certificate for people that have been diagnosed with fibromyalgia for over 20 years, managing for 20 to 30 to 40 years. Cause I know we're out there. We're in this group. And so that's the thing, like we want to get it done and we want the next generation to not have to reinvent the wheel or go through the same hurdles and same adversity. That means a lot to me, especially in my story of how I struggled with adversity, getting through high school, getting through college with fibromyalgia and chronic pain. So I understand, and I don't want anyone to go through what I went through. So that's why change is needed. Change is coming. So rally your voices with us, reach out. We have an email address. So if you are watching on Facebook, just to let you know, Facebook gets really weird with our messages. So sometimes we miss messages. And what we're going to be doing is making sure we respond to messages every Sunday. But we do have an email address that you can send friends@supportfibro.org. That is our email address. Please send a message there if you have any questions or you want to set up a call or get in touch as well. Please just send us a message there too if you don't necessarily get a response in social media right away. Also, we don't necessarily click on links. It's hard for me if you just send a link. Please give context because I won't just click on a link because there's a lot of hacking and we cannot afford to get our account hacked. So if you send us some message in another social media account, please provide us context so we know that your account did not get hacked and you're not sending us a link to hack us. It's a very strange environment. That's why I encourage you to send us a message with friends@supportfibro.org. We do want to connect. Hello, friends. please, if you are out there, please connect with us internationally. We are trying our best to unify all of us together, right? We are a really big, wonderful community out there internationally. And I know it's very different internationally on how fibromyalgia is defined. So when we're doing our advocacy work in May, I just want to let you know that yes, this advocacy work with the congressional meetings is for the United States, but advocacy empowers all of us internationally. So if you want to chime in on social media, we encourage it because Fibromyalgia Awareness Month, let's go after it all of May. Let's raise awareness internationally. Let's work together. If you're part of a support group or another organization internationally, reach out. We love working with people. And we're building this community so that we can support the patient community better. Because again, I keep saying this, it's going to take more than just one person or one organization to do it all. We got to come together and unite and make the difference and be louder than we need to be louder and united in our voices. And we will do this. I promise you. So last thing on my list that I have to do. So we got this, we've in this together, and you are definitely not alone. And that's where we say no one fights alone over here at Support Fibromyalgia. And this includes other organizations, patient advocates, patient leaders. You are not alone on an island. You have the support. So let's figure out how we can work together, how we can support you internationally. I know we have friends in India, Taiwan. Carrie is out there. She is trying to make changes because the diagnosis criteria is not the same. It's not the same everywhere. Treatment is not the same. But let's take aspects that are good and instill that everywhere. So let's get us to a better diagnostic criteria for making a faster diagnosis for fibromyalgia, faster differentiation between other illnesses like Lyme disease, CRPS, EDS, and other autoimmune conditions as well, because we can rally and support each other. This is why we work with other chronic illness advocates too, to learn from them. And we definitely can get there with fibromyalgia, especially when it's with RA and fibromyalgia, lupus, and fibromyalgia. So we understand that there's different components. It can be confusing, but we can help our medical providers. We can help organizations across the country make better sense of it. So thank you everyone for tuning in. Have a wonderful rest of your weekend. Please take the self-care that you need. Self-care can be a rebellion, as another health coach told me. So shout out Elizabeth. Thank you for reminding me of that. Take the time that you need. I will be checking in with you much more coming up and scheduling our Foggy Fridays, our Brain Fog Fridays again. And we definitely need to move into more interviews. We're trying to work on a new interview. So check out our podcast as well. From a new rheumatologist. There's other medical providers who are doing some podcasts on fibromyalgia. We will get the medical providers the support that they need and in turn transfer over to patient treatment. I'm getting more enthusiastic the more clinics I work with as a health coach at work. There are passionate medical providers out there. They exist. I promise you they exist, and they're amazing. I've had a great chance to connect with a lot of them. So I am really empowered by it all. So stay tuned for more. And again, please sign up for the survey. You can be anywhere in the world to fill out that fibromyalgia family survey and understanding how fibromyalgia affects the family. If there's other members of your family that have fibromyalgia, important patient-driven survey that we launched with the Veteran Voices for Fibromyalgia and the Fibromyalgia Chronicles, Pain Chronicles. So please fill out that survey for us. It really is going to make a difference, and stay tuned for more. Thank you so much. I am Melissa Talwar, the Executive Director of the Support Fibromyalgia Network, and I'm also a board-certified functional medicine health coach. Talk to you soon. Bye.